Section 11.2, health insurance benefits. Yesterday, we talked a little bit about how much each person generally pays for insurance. We looked at the person who has the insurance paying like a percentage of it. Usually the place they work for pays, for instance, 80% or 70% or whatever. What you guys had to do was you had to subtract it from 100, take that percent times the amount that they actually charge for a year, and then divide it into the number of paychecks. So I had some of those online yesterday, but I forgot quarterly, which is 4 times a year, and semi-annually, which is 2 times a year. So I had that on the board, so hopefully you saw it. Also, one other thing that I forgot was some places have optional dental and vision coverage. Here they do have optional dental and vision, but the person who wants it has to pay the entire thing. They don't offer a percentage here. I know at Bobcat, they do offer either a percentage or they pay the whole thing. So it depends on where you work. Some places pay for the whole thing. Some places pay for a percentage of it. Other places offer it so you can get in on the group rates, but they don't pay for anything. So keep that in mind. Today we're going to actually calculate the amount that the patient pays for health insurance. It gets kind of tricky, but there is a table that we're going to kind of go through, and as long as you are in the right column of the table, I think you'll be okay. Just because you have health insurance doesn't mean that all procedures are covered. The things that determine what services are provided are the insurance plan and the state you live in. For instance, here, the school is on Sanford Insurance. Sanford may not cover every single procedure that is out there. They have their set procedures that are covered, and they don't cover them 100%. They cover a percentage of them. Usually it's 80-20. If they have to send you out of network, then you might have to pay like 70-30. So they would pay 70, you would pay 30. So usually if it's out of network that they have to send you, you have to pay for it a little bit more, but that's kind of the way it goes. The state you live in as well matters. So when Asha had her cochlear implant surgery, there was nowhere in Fargo that did the surgery. Nowhere in North Dakota, actually. So they sent us to Minnesota. So we went to the University of Minnesota, and that was out of network. It's the only place that we could have sent her to. So we probably paid out of network fees for that. Sometimes if they don't have a provider in state, then the out of network doesn't really apply depending on where you go. But you kind of have to check it out before you do it so you kind of know ahead of time what you're paying. The deductible is the amount of money you have to pay first before insurance starts paying. Some procedures, there is a deductible, some there are not. So you would have to pay the first, $1,000 or something before they pay. So check that out as well. Sometimes there's a copayment. Every doctor visit on like my Sanford plan usually is like $30. It's a standard copay. If it's a flat payment, it's a copay. If it has a percentage that you pay, then it's co-insurance, and then you pay like 30% or 20% or something like that. The amount paid by the patient is your deductible, plus your co-payments, plus your co-insurance, plus any hospital charges that are there. Sometimes hospital charges don't apply. It only applies if you have to have surgery or something like that. The doctor bills and whatnot are kind of separate and are sent separate. So here's your example. They look like ginormous questions, but if you take one piece at a time and write that part down, it's usually a lot easier. So we have Brooke. She is single, has a health insurance plan with the benefits shown on page 421. You might want to grab that table and check it out. After meeting her deductible, her recent network healthcare costs included the following. So let's look at the table for a second. It shows a network column and a non-network column. So it has sections. You'll want to stay within the sections so you kind of know what to do there. So for the deductible, she is single, and it says her network health. So we're going to go in the single column. We're going to write down $1,000. So her deductible is $1,000. So I'm going to write that next to it. Some amounts you're just going to have to grab off the table and write them down. Others you have to do a little bit of calculating. Then it says the next thing, hospital charges. If you want to go down the table in the book so you know you hit them all, that is fine. If you want to follow them through the paragraph, that's fine too. If it's a paragraph, it wouldn't be a bad idea to like circle it when you've completed it so you know which parts that you've done and which parts you haven't. But generally, I'm going to do A through H. A will be the deductible, and it will say that on there. So when you've seen the deductible and written it down, you're done with that part. So we are done with part A. The next thing I see in the paragraph are co-payments for 8 physician visits and 9 specialist visits. So I kind of lump the co-insurance and co-payments together. Not everyone understands the difference between them, but basically a co-payment is a flat fee. A co-insurance payment is a percentage. Okay, we're going to lump them into one. So for the co-payments and co-insurance, co-payments, 8 physician visits. So let's look at co-insurance / co-payment. So look at that section. It's the third section down. For every physician visit, this person has to pay $20. Okay, so physician visits were 8. So for that one, we have 8 times 20. So we have 160 so far. And then it also said she had 9 specialist visits, which are $30 a piece. So 9 times 30, which is 270. Okay, so we did this one. We did that one. Following hospital surgery, she made co-payments for 12 physical therapy visits. Okay, so now you have to go back into that section. And physical therapy says 20%, but there's a double star. So look below on the very bottom line of that table. It says percent of total cost that you pay. So remember yesterday when they gave a number, it stood for the amount that the company that you work for had to pay. This one is actually the charge that you would have to pay if this was you. So for co-payments, there's going to be 12 of them at $85 each. And she needs to pay 20% for those physical therapy visits. So here's what that part looks like. So we have 12 visits, $85 a piece, and she has to pay 20%. So 12 visits, $85 each, she has to pay 20%. $204. Okay, so we did this one. She had 4 co-payments at the pharmacy. So that's retail pharmacy. They have generic prescriptions and then they have brand name. So generic obviously are going to be cheaper. Those are $10 each. Brand name, $20 each. So 3 generic drugs and 1 brand name drug. So 3 generic would be 3 times 10 or 30. Oops, that's pharmacy. Let me get out of that section. 3 times 10 or 30. For that, you could just list it because you probably know how much that is. And then 1 brand name, which would be 20. So for pharmacy, a total of 50. I do want you to list them separately and then you can total them after that. So if we don't have any other co-insurance and co-payments, I'm going to add those up here at the end as well. So we did the local pharmacy things. Then it says hospital admission charge was $200 and hospital bill was $34,560. Where do you put those? Did it say anything about an ER charge? No. So we're just going to zero that out. It didn't say anything, so you don't assume that you have it. Did it say anything about an ambulance charge? No. So ambulance, again, is 0 as well. If you did have those, ambulance is $100, ER room is $100 as well. So you just take the numbers and you put them in there. The only one we haven't done yet is the hospital charge, so let's go back to that one. I'm going to draw the arrow down here so I can look at it. For hospital charges, I usually put the admission charge and the hospital charge in the same one. So I'm going to put a flat fee of $200 in there. I'm going to put $200 there. And then I also need to figure out what percent of $34,560 do they need to pay. So for hospital, this person pays 10%. Okay, so $34,560 times 10%. That basically just takes off a 0. So $3,456. Okay, so you add your 200 to that. So you get 3,656. And for the other one, 160 plus 270 plus 204. This total is 634. And then, of course, we're going to add them all together. So 1,000, 3656, 634, 50. And there was no mail order pharmacy, so we'll put 0 there as well. So I get $5,340. Okay. It looks like a lot, but if you do one part at a time, it is not so bad. They've actually revamped this table to make it a lot easier for you guys to use. So basically, the only ones you actually have to do percentages of would be the physical therapy ones. They used to have so many visits are free, and then after that, you have to pay this much percent. They've changed that now, so evidently, when they did it, they looked into what's the average or what did most places do. You do have to pay a percentage for the hospital charge as well. Keep the admission charge in with the hospital charge because that's kind of where it goes. But I do want each number listed separately first, and then you can lump them together for a total for that particular part. So for C, I would want to see 160, 270, 204, and the total so that I know you did them each separately first. The zeros, you don't really have to show unless it tells you, or if it's A, B, C, D, E, which is what you guys have to do, just put a 0 there and you don't have to even say, what it's for. So $5,340 is what this person has to pay. Some of the things that I noticed from years past, people think that they have to pay the whole entire hospital charge. You do not. If you did, most people would not have procedures done because that's a lot of money. I talked about yesterday, I think Asha's actual surgery without doctors was about $350,000. So if we would have had to pay that, she probably wouldn't have been able to have it done. Okay, so that's why insurance is good because eventually if you happen to need it, you don't have to pay the entire charge. And I guess if you calculate how much you have to pay in premiums, you probably pay a lot of that, but that's not all at the same time. So that's what it's there for. It's there in case you need it because certain procedures are a lot. They charge you for every Band-Aid used, every piece of gauze, which is kind of ridiculous from our perspective, but that's how they keep track of things and that's what they do. So that's what insurance is for you to use it and so that you don't have to pay quite as much. There's no other tricks to this one other than you have to do each part separately and then add them together.